Hello again. This is Deborah Valerie from 60 Plus Black Women Expats. And this was not a planned broadcast, but I couldn't pass up the opportunity to answer a question that a lot of people who are considering living abroad, especially the 60 plus group or the group approaching retirement, really any age group that has physical medical needs and think they have to stay in the U.S. to get the best medical care. But I had a wonderful example. I've had nothing but wonderful examples since I landed here January 11th of this year. Is when I relocated to Manta, Ecuador. And I tell people in previous broadcasts on this channel, and I do hope you like, subscribe, and share, because I want to get my numbers up. I want to get the time people spend viewing up so that I can dedicate more time to making videos that I hope will answer your questions and give you valuable information that you haven't been able to find anywhere else, or that at least you'll know you can come here and ask questions and that I will do a broadcast and try to answer it. So, one of the concerns, especially from family and friends and from yourself, if you haven't done any research or investigating any further or just starting, is I want to move. I don't want to jump out of the frying pan into the fire. I don't want to move to a place where my medical needs are either unaffordable, unaccessible, or less than what I am getting right now in the U.S. And I hear that all the time from people who have not traveled abroad or lived abroad, or are just starting to investigate that. So I will speak to the medical care that I have been receiving here in Manta that was not guesswork. That was one of the things that made me choose Manta, Ecuador, was the type of medical care that is available here. It is available, it is affordable, and it is high quality. It is not, the way their medical system is set up, it's not on a capitalistic type of economy. It's not set up that way. So there's no middleman. There's no insurance companies. I mean, yes, there are insurance companies here. There is a government insurance for those over 65 that is similar to our Medicare in the States. That's a lot less. That is a very good quality one that I will be applying for as soon as I get my temporary residency and get my cedula, which is something that I'll explain in another interview, but not today. But they do have that available. They also have private insurance. But what's most attractive is you can afford good medical care with absolutely no insurance. Now that's barring a big emergency where you have to be in a hospital. And the examples that I can speak to firsthand, this is something like I said, I had investigated for about a year at several places. Panama is excellent health care. Manta, Ecuador is excellent health care. When I landed, I got a total workup. I already knew someone who had a doctor that they love, and she's the doctor of several of the black expats. So one of the reasons I chose Manta was the community of black expats that have already settled here. And it's a soft, very soft landing when you are leaving your home country and selling everything and deciding to live in another country, to have a community that is not only there but is willing, that has a system of sharing information. So I had an attorney before I came. I had a person who could take a survey on my medical needs and let me know that they could and would be met well here and affordably here. When I landed, I had a video of the place I was going. I didn't do a boots on the ground, but I knew exactly what I was moving into because I didn't have a photograph. I had a video starting on the outside of the building, the neighborhood of the gated community, through the elevator, up the elevator, into every single room. But that's not what this is about. That's the soft landing of having a community of people who are willing to share information. This is about the medical care. So I called the doctor, my very first doctor visit. She came to my house, to my apartment. I did not have to go into an office. I'm not ill. I wanted to establish a primary care doctor here where I'm going to be for the next 6 months, a year, who knows how long. But she made a house visit. It was $60. Not $60 deductible, $60 out of pocket, $60 copay. No, it was $60. And she was not rushed. She spent well over an hour taking a very thorough history, wrote up orders for me to get lab work so she would have a base to go on for everything. My vitamin level, my anything that she might want to have answers to, because there's a history of thyroid disease, and on my mother's side, I had an X-ray done, or sonogram done. I had all that work done, and that's before she even left. She had written up the orders, and I could just go at will without an appointment to get these things done, and I did. And the very next week, she came back and read the results. She wrote up prescriptions. Again, $60 home visit. I had a friend that was coming from the U.S. that was bringing medicines that I can't get here, and it required the doctor signing a letter of permission because, of course, those prescriptions had my name on it. No problem, she did it. I faxed it to my girlfriend. She had no problem bringing them into the country for me. No extra cost. This was all done over the phone in an email. What prompted me to do this interview is what happened today. My girlfriend came in about 2 weeks ago on a Wednesday, and she was having pain in her knee. She's had pain in her knee before. We've done a lot of walking, and the swelling and the pain was getting worse. I finally thought, call your doctor. Now, she is not getting residency here. She is just a visitor of a person who still doesn't have residency yet. But I called my doctor. I called my doctor on a Friday night, and she came and made a visit Saturday, today. Saturday morning at 9 o'clock, the doctor was here. She gave my friend a thorough examination, ordered 2 prescriptions, injections, had them delivered to my home, and waited until they arrived. It was a Saturday, and the doctor paid a visit to the apartment. It wasn't more than the regular $60. It wasn't extra. I've never spoken to an answering service. Her answering service is her cell phone, WhatsApp. I call her, she calls me back. She spent probably 2 hours here. She wrote for my friend to get a sonogram, an x-ray of the knee. She gave her the injections and treated her, and then left. The entire thing was $60 for the doctor, $23 for 2 injections that were delivered to my door. And it just so happens I had scheduled a massage, so my girlfriend and I both had massages. Hot stone, reflexology, sometimes acupuncture, all that for $35. I could not have afforded that type of care in the U.S. because I would still be trying to reach my annual deductible and out-of-pocket and co-pays. There's no debt. When she left, everything was paid for. So I felt like, yeah, I could have included this in a much longer interview, but this comes up all the time, and I wanted to be responsive to people who think they cannot leave the U.S. and get quality health care. I did an interview that's on this channel with Joel Wynn, and I certainly hope you watch that interview. It is more than an hour of information about Manta, Ecuador, because she has been here 5 years and largely responsible for a lot of people relocating to Manta, Ecuador. So she is a wealth of information, and like I said, that interview is on this YouTube channel. And so I already knew what I was walking into, but I wanted to do this and not wait till I do another long interview, because that's a question that always comes up. It comes up on my channel, it comes up on other people's channel, and I understand the concern, because at our age, over 50 and people younger than 50, we have conditions that we have to be concerned about when we travel, if we're going to a place where we can get that type of quality care. Oh, I mentioned Jules' interview because she mentioned that the U.S. healthcare on an international level, it's not even in the top 20. I'm not sure if it's still in the top 30. I thought it was around 27th in the world, but Ecuador is either 8 or 9 in terms of the quality of health care that you can receive here. So not only can you match, but you can exceed the type of health care that is available by moving abroad. And that is also very affordable. So that's it. I did not want to go on and on. This whole thing was my amazement that someone who is not even going to become her patient, who is just a friend of a patient, that she would make a house call on a Saturday to make sure that someone got the medical care that they need. And she enjoyed doing it. She loves doing it. She says that's what her calling is, and that's the way that has been my experience with the medical services here in Manta. So if you have any further questions regarding that or something else, be sure to comment, to like, subscribe, and share. Thank you. Until next time. Oh, before I end, because we are so close, we are doing my group. I also have a Facebook group that is Black Women Only. Now the YouTube channel, of course, is open to anybody. The focus is Black people moving abroad. But the Facebook group is Women Only, and it is also by the same name, 60 plus Black Women Expats. And we are less than 30 days away from our very first meetup. And I consider this an international meetup because the women who are coming are part of the group and are coming from various places in the world. But we are going to meet up in Panama on April 15th through the 19th. And we are combining our meetup with Panama's cultural relocation tour that is hosted by Charlotte Van Horn. And these tours, I think they're in their second or third year, and they are normally sold out. and we have about 6 spots still available as of last Tuesday. So I'm hoping if anybody wants to join us, that would be the place to not only get information about Panama and Ecuador, but from the other women that are also going to be joining us. And even though it is very last minute, there's really not a lot of planning involved because we did combine it with a very already established tour. The only thing that would be up to you would be your airfare. Everything else, once you pay for the registration, your accommodation, the cost of the entertainment, most of your meals, your pickup at the airport, your delivery back to the airport, all of that's taken care of. So there's really not much planning you have to do. It's just a decision of, do I want this life-changing experience of meeting with seasoned international women, and there'll be, and some of them bring in friends and spouses, and that's fine too, but who can answer those questions of what it's really like to live abroad. So I wanted to mention that because we do have a few spots open, and I want this one sold out. So until next time, till the next broadcast, be blessed and never give up on your dreams. Bye.